Welcome everybody to the Virtual Hearing Aid Show. My name is Christopher Medina. I am your hearing care professional, and I want to welcome back Gary Dorf, Doctor of Audiology, representing Oticon today. So welcome back, Gary. Thank you so much for coming by again.
Well, Chris, it's always a pleasure to be here with you and to share recent information. I appreciate the invite, and obviously I did a good job the first time, so you decided to invite me back.
Definitely. Gary is a smart man, let me tell you. So I understand you have some information regarding some research and studies about hearing loss in general. Can you expand a little bit on that?
Yeah, and I think it's important for your audience to know that there is a lot of research going on at major institutions looking at hearing loss and how it impacts our social ability, our engagement, and also some studies have pointed very, very strongly to the fact that hearing loss can attribute to cognitive decline and dementia. It's not a direct correlation, but the problem is most people with hearing loss tend to withdraw from social engagements, from parties, from weddings, going to the movies. And that in and of itself is a concern in terms of what we're seeing as we age. It's really important for people to get their hearing tested so you can ascertain what degree of hearing loss they have and what impact it might have on their social abilities.
Very nice, Gary. Very nice. So how does Oticon design hearing aids, and what do they decide is important when they make them?
Well, Chris, that's a really important question and a great question. Oticon is a company that we talk about thinking about the brain first, okay? Even though the ears are the conduit, the brain is really what deciphers sound. We're able to recognize certain voices, where sound's coming from. So it's important for us to design hearing aids with that concern in mind. So when we design hearing aids, we look at many, many different things. And it's important to understand, yes, we are feeding sound through the ear, but we also have to take the brain into consideration.
Well, interesting. So can you tell us a little bit of what's new with the Real products?
Sure. So Oticon introduced a new product called Real, and I have to tell you that it has been our most successful launch in our history. And Oticon has a very, very lengthy history. The product has come out and it's been accepted by everybody with the new features that we refer to as wind and handling noise to manage all the extra information that a patient perceives when they're wearing a hearing aid. So for argument's sake, if I walk into a Starbucks, all that background noise, it can be annoying. And what we're trying to do is minimize those by using something called a sudden sound stabilizer. And that's something you will be able to control with your patients. The other two features that we've added also is dealing with wind noise. A lot of people come back and hearing aids can pick up a lot of wind noise, and it can be disturbing because it doesn't give you the discrimination ability because the wind is masking that out. So we've done a really nice job of minimizing the impact that wind has. And then what we talk about handling stabilizer is when you touch your clothes, when you comb your hair, when you take off your glasses, hearing aids have a tendency to make noise. And the problem is that can also be distracting for a patient. So all of those things combined with the deep neural network, which we've talked about in the past, to manage signal to noise ratio, these things have really made a tremendous improvement on the quality of sound and the impact in terms of how it can improve the patient's lives.
Okay, very nice. So all those little details have been taken care of, huh? Yeah, because I do get some patients that, they always say, oh, I'll take off my glasses. I hear that because the microphones are right there, right?
Correct, absolutely.
So that's getting taken care of with the new Real.
Absolutely. And ultimately, Oticon's position is design hearing aids that are going to enhance the ability for the patient to communicate. We try and minimize background noise as aggressively as we can. Now we're doing these other new features that are going to take some of the other, sound that really is impacting it negatively. So the hearing aid has a better sound quality and the ability for patients to understand speech in difficult listening environments.
Okay, excellent, excellent. So yeah, let's get into a little bit about the new OWN, which is the custom product line, right? That comes in the IICs all the way up to the ITE, correct?
Correct. So the Real products are generally just behind the ear type RIC hearing aids. We also introduced the OWN several months ago that is for the custom style, for the people that want very, very tiny hearing aids that fit all in the ear or have more cosmetic concerns and want something smaller. So those are devices that can be customized and placed fully in the ear so you don't have to worry about hanging the hearing aid behind your ear. Both technologies have some similar processing to it. They all offer technology as we were just talking about. However, not all of them offer Bluetooth compatibility. So for those people that want to be able to use your iPhone or your Android phone to control the hearing aid, some of the very, very tiny own products, they don't have that capacity. So understand where the real products do have that ability to manage all those other avenues of technology.
Yeah, so the real products, which is your receiver in the canal mini right, and there's also a power BTE.
PTE, correct.
Then you got the IIC all the way to the ITE. And then, so the Bluetooth compatibility, the real doesn't matter which model you choose, the Bluetooth is there. Also with a rechargeable option, is that correct?
Correct. So let's talk about the rechargeable option for a minute. So if you see in front here, this is one of our rechargeable options. We call that the smart charger. So all the real products have the ability for the battery to be recharged overnight. I am wearing hearing aids. I pop my hearing aid in the charger at night, usually about 10, 11 o'clock at night. I wake up about 7 in the morning. I put my hearing aids on, and I get pretty much a full day, a good 16 to 18 hours of battery without ever having to worry about changing a battery. In the own products, we do not have any rechargeability at this particular point. Those are all battery operated at this point.
And if they want Bluetooth in the custom products, it would be the ITC or the ITE at this time.
Half shell, full shell, and canal.
Excellent, excellent. So Gary, the last question here. So let's talk a little bit about the accessories, right? They have to have Bluetooth in order to be compatible with the hearing aids, right?
So the advantage of having Bluetooth in the hearing aid is that we have several different accessories that can really enhance the conversation for the patient and really manage some of the things that are difficult for the patient. So TV is one of the main things our customers utilize.
Yes.
And TV can be a struggle. However, with Bluetooth technology, you purchase a small little box. It's our TV box, which is our most popular accessory. Hook it up to your back of your TV. Very simple. We give you all the cables you need to, and that signal will go directly to the hearing aid. So the patient basically has their own little control. They can't change channels with their hearing aids, but they can modify the volume control and make it manageable so one of their partner's spouse, children are watching TV. It's not going to be disruptive. So the TV box is one important capacity. We also have a remote mic called the Connect mic, which works great in one-to-one if you're in difficult listening situations. You can hand the mic to your spouse and they could talk and minimize the background noise. Those are the two most popular items. There are remote controls also, that small remote control, which is an accessory device. Truthfully, most people today use their phone as an app. So all the controls that the patient wants really is on your app on the iPhone. We are currently using what we refer to as the companion app, and I know you're familiar with it.
Yes.
And I use it all day, able to answer my phone calls, able to adjust my volume control. Options for accessories are minimal in terms of its usage. So I would say yes, Bluetooth gives us the ability to manage those things. And your phone, whether it's an iPhone or an Android, will have the companion app for you to manipulate the hearing aid as you see fit.
As far as iPhones, pretty much all the newer iPhones are compatible. Androids, on their website, you can kind of scan a code or check on the Oticon compatibility to see if your Android is actually compatible with the app. Yeah, the app's mainly for all the Bluetooth devices. Is that correct?
Correct.
Okay. Perfect. Yeah, you can control the volume. Can you even locate your hearing aids?
You can find your hearing aid.
Hearings, the last where you left them.
Yeah. We also have on our app what we refer to as a hearing fitness. So if a patient really wants to see how they're utilizing their hearing aid during the day, kind of like they look at their health and they look at their steps, they can look at the app and see how many hours they're wearing the hearing aid. And as a provider, I always encourage my providers to set that for them before they leave to maybe 5 or 6 hours a day. So that way you can be guaranteed that if they look at it, they know how many hours they're wearing the hearing aid. So there's a couple of cool features on the app.
Okay, great tips, good the companion app, guys. Got to download it. All right, guys. Well, there you have it. The new Real and Own from Oticon. And we're going to put some links on those studies just so if you want to take a look at it, you can take a look at it. And I want to thank Gary Dorf, Doctor of Audiology. Thank you so much for coming again. It's always a pleasure
Always
to
a
see
pleasure.
you.
Yes.
Yeah, I'm always flabbergasted by Gary and his intelligence. I'm just like, how is he so smart? But yeah, thank you again, Gary. If you guys have any questions or comments, post down below, and me and my team will get back to you as soon as we can. So take care, guys, and we'll see you on the next one.